Many of our patients were homeless, and the bulk of the food that's provided to them is not necessarily what's best for someone who has diabetes.
One of the patients that I interviewed said for years and years it didn't really matter to her what her numbers were. She was going to live the life that she wanted to live, and people weren't going to tell her and try and control what she ate, what she did.
What's really great about this project and the APhA Foundation is that we are changing the way that people are cared for that have diabetes.
I've had the privilege over the last 2 years of working with communities all across the country that are focused on helping patients who are from disenfranchised populations or low-income populations better manage their diabetes.
The only stipulation within the project is that there has to be a pharmacist on a healthcare team that meets with the patient one-on-one and helps them achieve their healthcare goals.
So patients did receive visits, one-on-one visits with a pharmacist.
Oftentimes the pharmacist has the closest relationship with the patient. They see him far more frequently than many of the other providers do.
We've seen pharmacists troubleshoot and work with other members of the healthcare team and really figuring out their way of integrating within existing teams or finding new opportunities to engage with patients.
I interviewed a patient in one of my communities in California, and the first thing that he said to me was that Project Impact saved his life.
It's just one more piece of the puzzle that demonstrates that pharmacists working closely with patients make a huge difference.
Getting from his pharmacist and his healthcare team was what really helped him make changes in his life that made him really come to the awareness that he had to take care of himself, he had to take care of his diabetes, and that's how he changed his life.
We can empower patients with the education about what the medicines are doing and why they're taking them, and help them remove the barriers to getting those medications and using them correctly. People can manage their own health. Pharmacists are uniquely qualified and uniquely trained to be able to provide that care to patients, and they have the time to do it and the access to do it because they're in every community across America.
Having the pharmacist as the diabetes doctor that kind of led their community.
We've been following about 100 patients over the year in this model, and we've seen great improvements in clinical outcomes such as A1Cs and cholesterol, but also just individual patient stories, patients that have never been able to manage their disease before and now they have been able to.
The pharmacists really helped them do that. They really made an impact.
And we know that working together on diabetes, we're going to make a big difference.
We make an impact together on diabetes.